Hey guys, welcome back to Ask Dr. Goyette, where we answer your questions about health and the zone technique. Today's question is, how long does the balancing last, or how long do you take for the balancing to last?
I'm going to answer that by just giving a little bit of context. So, when you're talking about balancing, a patient may come into our office with a certain number of symptoms, and I will feel points along the base of their head to determine out of the six systems that make up their body which systems are balanced and which systems are unbalanced. And depending on which systems are unbalanced, I would then go and stimulate the corresponding 4 points along the spinal cord to charge that particular brain center into self-regulating and self-monitoring mode. So when you're saying balancing, that's what you're referring to. I'm going in and finding which system is out of balance. And then once I identify which system's out of balance, I then go into resetting the brain center into its natural state of self-regulation. So to the question then is, how long does it stay in a balanced state? Well, you are designed to be in a balanced state. That is your natural state. So once I initiate the balancing, you are automatically self-regulating at that point and in that moment. So you stay self-regulating. Then the next question may be, well, if I'm self-regulating and self-monitoring, why do I still have symptoms, or why am I still not 100%? So the second piece to that is, for every moment that's passing and your body is self-regulating, you're feeling better, you're healing tissues or organs that need to heal and repair. And the more they are repaired, the better you feel and the better they function. So I may often put people on some multiple visits per week for a period of time. And part of that is not because you get out of balance again, but to continue the momentum of the self regulation and making sure that that brain center is fully balanced and fully stabilized. And when it is, not only does the back of the head feel clear, indicating that it's balanced, but you feel great, you function great, and the symptoms that you were having have dissipated. And because you're in your natural state of health, I expect you to live a long, healthy life, feeling great and functioning great. So you don't actually lose the regulation or the balance. It's a matter of just making sure we're getting full momentum and balanced it completely and keep it stabilized so that you're in self-regulating mode. So you don't really lose it. We're just making sure you fully regulate and stabilize 100% before we actually release you from active care if you met your recommended goals, or if you choose, once you meet your goals, if you choose to stay on for wellness, then you're just making sure you're fine-tuning that regulation so that it's very efficient and you keep you nice and healthy.
All right, there you have it, guys. Thanks, Dr. E, for answering another question from our patient. So for others that want that have something that you want Dr. G to answer, just send us your question and we'll choose for our next week's segment of Ask Dr. G. So for now, see you next time.